Welcome back to the deep dive. We're diving headfirst into a fascinating stack of sources today, all focused on a health puzzle that can sometimes affect our pets. We're tackling supraventricular tachycardia (SVT) in dogs and cats. And your sources give us a really detailed roadmap for this specific kind of rapid heart rhythm issue. So our mission for this deep dive, to zero in on what SVT really is, how it shows up in dogs and cats, the detective work vets do to figure it out, and the ways they can help manage it. We'll be using the material you brought right here as our guide.
Absolutely. And it's worth emphasizing up front, just like these sources do, that while, yeah, a fast heart rate can be normal sometimes, SVT isn't that. It's a specific electrical issue, and it can lead to some pretty dramatic signs like weakness or even collapse. So let's dig into what makes this condition unique based on this info.
All right, let's kick things off right at the beginning then. Based on these sources, what's the fundamental definition of SVT? Like, what's actually happening inside the heart?
Okay, so at its core, SVT is a rapid heart rhythm. But the key is where the electrical signal driving that beat starts. It's coming from above the main pumping chambers, the ventricles. So that means it originates in the upper chambers, the atria, or maybe that junctional area, the AV node. And the big distinction your sources make is that it's not the heart's normal pacemaker, the SA node, just speeding up because of stress or exercise or something like that. It's an abnormal electrical event basically taking charge of the rhythm.
Okay, so it's definitely not just your dog getting super excited to see you or your cat being stressed out at the vet clinic.
Exactly. That's what we call sinus tachycardia, totally normal, the body's appropriate response to things like pain or fear or excitement. SVT, as the sources explain, is fundamentally an abnormal electrical circuit or focus running the show.
And when this abnormal rhythm kicks in, how fast are we actually talking? What do the sources tell us about the heart rates involved?
Oh, they give us some pretty stark numbers. In dogs, the heart rate during SVT typically blasts past 200, often hitting 300 beats per minute, sometimes even more. Cats, they can go even faster. We're often talking 260 to maybe 380 BPM in cats.
Wow.
Yeah. And just for context, your sources mentioned the normal resting rates are way lower, maybe 120, 160 for puppies, 100, 140 for small dogs, 60, 100 for the bigger guys, and 140, 220 for cats, though, clinic stress often pushes cat rates up anyway.
So it's massively faster.
Yeah.
Now, vets rely so much on ECGs for heart issues. What does this super fast abnormal rhythm actually look like on that electrocardiogram printout, according to your sources?
Well, the most obvious thing is that rapid rate, right? Dogs might be anywhere from a 150 up to 350 BPM. Size matters a bit. Smaller dogs can have faster rates normally. But it's not just the speed. The rhythm is usually very regular. That means the time between each heartbeat, that R-to-R interval, it's constant. That's a really big clue. Your sources also point out it might not be going on all the time. It can pop up in sudden bursts and then stop. That's called paroxysmal SVT.
Okay. And what about the shape of the waves? Specifically the one showing the ventricles contracting the QRS complex. What does that usually look like?
Yeah, this is super critical information from your sources for actually identifying SVT. Typically, the QRS complexes look narrow and pretty normal in shape. What that tells us is that even though the signal started abnormally high up, it's still traveling down the heart's normal fast-track wiring system, the His-Purkinje system, to make the ventricles contract.
Okay, but here's something your sources really flag as a potential complication, something that can make diagnosis tricky. They say sometimes SVT can look confusingly like a more dangerous rhythm called ventricular tachycardia, or VT. How does that happen?
Yes, that's a major diagnostic challenge they describe. It happens if the pet already has an issue with that fast-track wiring system, like a bundle branch block. Or there's something called aberrant ventricular conduction, where the impulse basically takes a detour through the ventricle muscle instead of the fast lane. In either case, the electrical signal spreads through the ventricles abnormally, making that QRS complex look wide and maybe a bit bizarre, which can absolutely mimic VT.
So it looks like the signal isn't using that normal high-speed pathway. How do vets try to tell the difference then?
Right, it's crucial. Your sources mention a few key things. One is response to medication. If you give lidocaine, which is an antiarrhythmic drug, and the fast rhythm stops, it was much more likely VT. SVT usually doesn't respond well or at all to lidocaine. They also talk about trying things called vagal maneuvers first, like gentle pressure on the eyeballs or massaging the carotid sinus in the neck. These can sometimes interrupt certain SVTs by affecting the AV node. And interestingly, they mention a precordial thump, basically a firm thump over the heart, especially for rates in the 150, 250 BPM range.
Yeah.
These maneuvers usually don't work for VT or just a fast sinus rhythm.
So checking the QRS shape, usually narrow, and seeing how the rhythm reacts to things like lidocaine or those maneuvers helps sort it out. What about the P waves, the little bumps showing the atria firing?
Good question. The P waves can be tricky in SVT. They might look different from the normal P waves, or sometimes they're completely buried inside the T wave of the beat right before it, just because everything's happening so fast you just can't see them. And your sources also highlight a specific type of SVT, atrial fibrillation, or AFib. In AFib, the atria are just kind of quivering chaotically, not contracting properly at all. So you don't see any distinct P waves, and the rhythm itself becomes irregular, totally chaotic, unlike the very regular beat you usually see with other SVTs.
Okay, so we've got a picture of what SVT is and what it looks like electrically. But the big question is why? Why does the heart suddenly start doing this? What actually causes this abnormal activity?
Well, your sources lay out two main electrical reasons, or mechanisms. The most common one is called reentry. You can sort of picture the electrical signal getting stuck in a loop, like an echo. Instead of just going forward and finishing, it circles back and continuously re-excites the same area of heart tissue over and over again. This constant looping generates that really fast, usually very regular rhythm we talked about. It often happens where heart tissue is damaged or scarred, creating the right conditions for these loops to form.
Like an electrical short circuit almost.
Kind of. Yeah, that's a decent analogy. The other main mechanism described is abnormal automaticity. This is where some heart cells, which aren't supposed to be pacemakers, just start firing off electrical impulses all on their own, spontaneously and at a really rapid rate. This can sometimes lead to a rhythm that's a bit less perfectly regular than reentry. And the sources also make a point of mentioning a specific type of reentry caused by congenital accessory pathways. These are basically extra electrical connections between the upper and lower chambers that shouldn't be there, present from birth. They act like shortcuts, bypassing the normal traffic control, the AV node, allowing impulses to zip back and forth way too quickly, setting up those reentrant loops.
Got it. So those are the electrical mechanisms. But what underlying conditions trigger these mechanisms or create the environment for them? Is it always just a primary heart wiring problem?
That's a really crucial point your sources make. It's often not just a primary issue. While SVT can be idiopathic, meaning they can't find a cause, very often it's secondary to something else going on. Your sources list quite a few common culprits. First, structural heart disease. Things like cardiomyopathy that's weakened or thickened heart muscle, like DCM in dogs or HCM in cats. Also, chronic valve disease, especially if it causes the upper chambers, the atria, to get enlarged. Congenital heart defects, even heart tumors. Basically, anything that stretches or changes the atrial tissue can create the setup for those reentry loops.
Okay, so heart disease itself is a big one. What else?
Then there's a whole list of non-cardiac or systemic illnesses. This is really important. Things like electrolyte imbalances, low potassium or low magnesium are big triggers.
Okay.
Hyperthyroidism, especially in older cats, is a classic cause. Certain drug toxicities, sometimes even from heart meds themselves, ironically. Severe infections like sepsis, major trauma, really bad anemia, even significant gut problems like pancreatitis or bloat, GDV, in dogs are listed. Severe lack of oxygen, certain cancers, the list is pretty extensive.
So it sounds like a major risk factor is simply having some other underlying health problem, particularly heart disease, but not always.
Absolutely. The sources are very clear. Structural heart disease is a huge risk factor, but you absolutely have to look for and rule out or treat those systemic causes too, because sometimes fixing that fixes the SVT.
Right. Now, switching perspectives to the pet owner, what are the signs you might actually see at home that could make you suspect something like SVT is going on?
Well, the signs usually happen because the heart's beating so incredibly fast. It can't fill properly between beats, so it doesn't pump blood effectively. This leads to reduced blood flow. Your sources say the most common things owners notice are weakness, just general lethargy or lack of energy, and exercise intolerance, like they get worn out way faster than they used to.
But you mentioned a more dramatic, really worrying sign earlier that the sources highlight.
Yes, syncope or collapse, that's fainting. When the heart rate is extremely high, blood flow to the brain can plummet, causing the pet to actually pass out. That's a huge red flag. And if the SVT goes on for a while or is really severe, that poor pumping function can cause blood to back up. That leads to signs of congestive heart failure, things like difficulty breathing, maybe rapid panting even at rest, or coughing. A vet doing an exam might notice pale gums or weak pulses because the circulation is poor.
It really sounds like the signs can run the gamut, from almost nothing to, well, collapse.
They absolutely can. Your sources mention that some animals, especially if the SVT isn't super fast or only happens now and then, that paroxysmal type, they might show no signs at all. The fast heart rate might just be picked up accidentally during a routine checkup. But they also note that clinical signs, the things owners notice, usually become apparent when the heart rate gets really cooking, often over 300 BPM in dogs.
And the owner might just see the weakness or the fainting spell and not have any clue that the underlying issue is this incredibly fast heart rhythm.
That's a really critical point your sources bring up about owner awareness. They often don't recognize it as an arrhythmia. They just see the result: the pet is weak or collapsed or just not right.
Okay, so let's say a vet suspects SVT based on some of these signs or maybe finding a really fast heart rate. What's the diagnostic journey look like? How do they confirm it and figure out the why?
It definitely starts with getting a detailed history from the owner about the signs they've seen and a thorough physical exam, listening carefully to the heart and lungs. But the absolute gold standard for confirming the rhythm itself is the electrocardiogram, the ECG. That's where you actually see the electrical activity. You confirm the rapid rate, you check if the rhythm is regular or irregular, and you look closely at those QRS complexes. Are they narrow, like typical SVT, or wide?
But what if the signs, like the weakness or fainting, only happen sometimes? The pet might have a completely normal ECG reading when they're actually at the vet clinic.
Exactly. That's a very common scenario, and it's precisely where a Holter monitor becomes invaluable. This is basically a portable ECG, a small device the pet wears, usually on a vest, that records every single heartbeat continuously, typically for 24 or even 48 hours, while they're at home doing their normal thing. This lets the vet capture those intermittent episodes of SVT if they happen during the recording period and see if they match up with when the owner noticed symptoms. For even less frequent episodes, your sources also mention event recorders or loop recorders, which the owner might activate when they see signs.
Makes sense. What about actually looking at the heart structure, imaging?
Echocardiography, that's an ultrasound of the heart, is absolutely crucial. Your sources really stress this. It's essential to look for any underlying structural heart disease. You can measure the chamber sizes. Are the atria enlarged, setting the stage for reentry? How are the valves working? Are there any birth defects? How well is the heart muscle itself squeezing? They also mention that during an episode of very fast SVT, the echo might show something interesting. The left ventricle might look normal or even small when it squeezes out blood and systole, but then look quite small when it relaxes to fill end diastole, simply because there isn't enough time between beats for proper filling. And chest x-rays, or thoracic radiographs, are also important. They help assess the overall heart size and shape and look for any signs of fluid buildup in the lungs, which would point towards congestive heart failure.
Okay, ECG, Holter, echo, x-rays. Any other key tests?
Yes, definitely blood work. Your sources emphasize checking electrolytes, remember low potassium and magnesium, and also thyroid hormone levels, especially T4 in cats, to rule out hyperthyroidism. Measuring blood pressure is also important because that really fast rate can sometimes lead to dangerously low blood pressure due to the poor output.
All right, so once the diagnosis of SVT is confirmed, and hopefully the underlying cause is being investigated, what's the treatment plan? How do vets actually help these pets feel better and manage the condition?
Treatment really has two main aims. First, if the pet is currently in a dangerously fast rhythm, especially if they're unstable, the goal is to acutely stop or at least slow down that rhythm. Second is the long-term management plan, trying to prevent future episodes, control the rate, and very importantly, treating whatever underlying condition might be causing the SVT.
Okay, let's talk about the emergency situation first. The pet comes in collapsed, heart rate is 350. What happens then?
Right. Immediate stabilization is the priority. Your sources mention trying those vagal maneuvers first, like ocular pressure or carotid sinus massage, because they're non-invasive. But they also caution that these are often unsuccessful in dogs and cats.
And then there's that surprising technique you mentioned earlier, the precordial thump. Your sources describe that as an emergency option.
Yes, they do. It's presented as a direct physical technique for emergency use, particularly in dogs, to try and acutely terminate the SVT when maybe giving drugs would take too long. They describe placing the dog on its right side, finding the spot where you can feel the strongest heartbeat on the left chest, the apex beat, and delivering a firm thump with your fist to that spot while watching the ECG. Your sources actually state this can successfully break the SVT rhythm over 90% of the time in dogs, although the effect might be temporary. It's definitely definitely portrayed as an immediate emergency intervention. Then, alongside or if maneuvers fail, intravenous medications are key. Calcium channel blockers like diltiazem or beta blockers like IV esmolol are common first choices. They work by slowing down the electrical signal as it passes through the AV node, which helps to slow the rate the ventricles are beating. Adenosine is also specifically mentioned, particularly for reentrant SVT. It has to be given as a super fast IV push. It works by temporarily blocking the AV node completely, which can often terminate the reentrant loop. But your sources warn it's extremely short-acting, and you have to monitor very closely because it can cause a brief, sometimes scary pause in the heartbeat transient asystole before hopefully the normal rhythm returns. Electrical cardioversion, a synchronized shock, is really reserved for unstable pets who aren't responding to medications.
Wow. Okay, quite a few options for the acute crisis. What about managing SVT day-to-day long-term?
Long-term management typically involves giving oral antiarrhythmic medications every day. The goal here is to keep the average heart rate slower and, ideally, prevent those symptomatic episodes of really fast rhythm from happening, or at least make them less frequent or severe. Diltiazem, the calcium channel blocker, is often a first choice, especially for just controlling the ventricular rate if the SVT is actually atrial fibrillation. Beta blockers, like atomol, are also very commonly used. Digoxin is another drug that's often added to the mix, especially if the pet also has signs of heart failure, as it can help with both rate control and heart muscle contraction strength. Now, your sources make an interesting point. Finding the right dose for long-term control isn't always straightforward. They specifically mention that for stopping actual reentrant SVT episodes in dogs with oral diltiazem, the dose required is often significantly higher than the dose used just for rate control and AFib or for other conditions like hypertension, so it might take some adjustment. They also note that if these common drugs aren't quite doing the job, other medications like quinidine or procainamide might be considered, especially if the vet suspects the SVT is due to that abnormal automaticity mechanism or maybe one of those accessory pathways.
Are there things vets and owners need to be particularly careful about with these long-term meds? Potential downsides?
Yes, absolutely. Your sources provide some important warnings. One is combining calcium channel blockers and beta blockers. They strongly advise against this unless under very specific guidance and close monitoring, because the combined effect can slow the heart rate down way too much, which can be dangerous. They also caution about using these drugs, especially beta blockers and diltiazem, in pets who already have weakened heart muscle function, myocardial failure, because these drugs can sometimes reduce the heart's pumping strength a bit further. And critically, this comes up again and again in your sources, managing the underlying cause is absolutely essential, whether it's treating the structural heart disease aggressively or correcting the systemic issue like hyperthyroidism. That's just as vital as the antiarrhythmic drugs themselves for long-term success.
Right, treating the root cause seems paramount. Now, your sources even mentioned something beyond medication, a more permanent fix in some specific cases, a procedure.
They did, yes. For those specific cases where the SVT is definitively shown to be caused by one of those congenital accessory pathways, we talked about those extra electrical shortcuts, there's a highly specialized procedure called radiofrequency catheter ablation. It's usually only done at major referral centers or universities. It involves carefully threading catheters up into the heart, mapping out the heart's electrical activity to pinpoint that abnormal pathway, and then using radiofrequency energy, basically heat, to destroy or ablate that specific tissue. If successful, it can potentially be a cure for that particular type of SVT.
Okay, so considering everything from medications to procedures to underlying causes, what's the general outlook? What's the prognosis typically like for a pet diagnosed with SVT?
Yeah, that's the million-dollar question, isn't it? Your sources are quite clear that the prognosis is highly variable. There's really no single answer. It depends heavily on several factors. What is the underlying cause? Is it treatable? How fast does the heart rate get during the SVT episodes, and how long do they last? Is there already significant structural heart disease present? And crucially, how well does the arrhythmia actually respond to the treatment they try? So the prognosis can be quite good, especially for animals that only have infrequent episodes, don't have severe underlying heart problems, or if the underlying cause is something totally treatable and reversible, like fixing hyperthyroidism in a cat. But unfortunately, it's often more guarded or even poor if the SVT is persistent or very frequent. If it's already caused complications like heart failure or weakened the heart muscle over time, that's called tachycardia-induced cardiomyopathy. Or if it's associated with severe progressive underlying heart disease that can't be fixed.
That makes sense. So what kind of follow-up or monitoring is usually needed after a pet starts treatment for SVT?
Ongoing monitoring is definitely key. Your sources recommend regular recheck appointments with the vet. Very often, follow-up Holter monitors are used periodically to see how well the medications are actually controlling the heart rhythm during the pet's normal daily life. Are they still having bursts of SVT? Is the average rate well controlled? Periodic echocardiograms are also important to reassess the heart structure and function as the underlying disease progressing. Are there signs of heart failure developing or improving? And blood tests are needed too, partly to monitor electrolytes again, check for any potential side effects of the long-term medications on organs like the kidneys or liver, and sometimes to check the actual blood levels of certain drugs, like digoxin, to make sure they're in the right therapeutic range. Given the complexity, referral to a veterinary cardiologist is often recommended, especially for tricky cases or if things like ablation are being considered.
And it sounds like making sure the owner is fully on board and understands everything is a huge piece of this.
Oh, absolutely. Your sources really emphasize the importance of client education. Owners need to grasp what SVT actually is, that it's this specific electrical problem, not just, stress or getting old. They need to know what signs to watch for, especially that weakness or collapse, and understand why giving the medications exactly on schedule every single time is so critical. And they also need a realistic picture of the likely prognosis for their individual pet, the commitment involved in lifelong monitoring, and, frankly, the potential costs associated with managing a chronic condition like this.
Wow, we've certainly covered a lot of ground here, really digging into SVT. We've gone from those tiny electrical loops causing the chaos to things like that, dramatic precordial thump in an emergency, all the way to complex long-term drug strategies, all guided by the really detailed sources you brought.
Yeah, we really have. We've seen SVT isn't just a fast heart rate. It's a very specific electrical disturbance. Often it's marked by that super rapid, very regular rhythm, and typically those narrow QRS complexes on the ECG. Though we learned there are important exceptions and complexities that can make diagnosis challenging. And diagnosing it hinges on tools like the ECG and Holter monitoring, plus that crucial imaging with echocardiography to hunt for those underlying causes. Treatment. It really runs the gamut from immediate, urgent interventions to slow things down, right through to lifelong medication, and really focusing on managing whatever else is going on with the pet's health.
Right. So thinking about everything we've just unpacked from these sources, the subtle signs like just being tired, the really scary potential for collapse, the fact that owners might be totally unaware it's an arrhythmia, and then those specific diagnostic clues like the regular really fast rate or that narrow QRS on the ECG, which, okay, might sometimes look wide.
It does make you think, doesn't it? If you had to boil all this information down, what single piece of information and what clue or observation from everything in these sources stands out most sharply to you? What's the most critical thing that should make an owner or maybe a primary care vet stop and think, hang on, could this actually be SVT, and push for that deeper look? Something that really cuts through all the other possibilities like just stress or age. What's the one detail you absolutely wouldn't want someone to overlook?